All right, everybody, we are back here with another Daily Doc Talk, and I am your host, Dr. Drew Timmermans. This episode is coming from another Ask Me Anything that I did on Instagram. So again, if you have not hit that up, head over to Instagram. Every Sunday, I throw up an Ask Me Anything question, and you guys can submit, and I do my best to answer them on Monday. So this question here came from a woman who she said she is menopausal, she is tired, she is cold all the time, she is struggling to lose weight, and she's looking for some guidance. So again, that is all the information that I have about this this potential patient, this woman. And so I'm just going to talk about some of the ways that I approach situations like this with my patients, and maybe this can give insight to someone who is suffering, or if you know someone who is suffering from symptoms such as this. So the first thing we know is that she's postmenopausal. So during the postmenopausal phase of a woman's life, hormone levels go down to bare minimum, drastically low levels. And for some women, this is not a problem. And there are some women who are postmenopausal and they don't really have a lot of symptoms associated with the low hormones. One of the reasons that this can happen in these women is that they're not, even though they have a low level of hormones, their sensitivity to the receptors of those hormones is still high enough. And so when you really start to look at endocrinology and symptomology in patients with whether it's high or low hormones, what really matters at the end of the day is how that hormone is attaching to that receptor and to what strength it's attaching to that receptor. And so you could have a patient with a normal level of hormone, but if it's not hitting the receptor appropriately, they could have symptoms of low hormones. Conversely, you could have a patient who has low levels of hormones, but it's hitting the receptor with high sensitivity, and those patients aren't going to suffer as many low hormone symptoms. But this woman, it sounds like she might be suffering from some symptoms of low hormones, because she is tired all the time, she is cold all the time, she is having trouble losing weight. And so two of the larger hormone systems that can kind of come into play with those are going to be testosterone and then thyroid hormone. So thyroid hormone is obviously not coming from the ovaries, and so that's not directly related to the postmenopausal state. But as we age, the thyroid gland can atrophy, and we can have a decrease in the amount of thyroid hormone that we are producing. So our brain produces TSH, which comes down to the thyroid gland. The thyroid gland makes T4, which is inactive. That T4 goes throughout the entire body and gets converted into T3. T3 is the active hormone, and that's the hormone that is actually going to stimulate the mitochondria of every single cell in your body to increase energy production. And so when we get a decrease in the thyroid hormone, everything in the body starts to slow down. We start to lose hair, our skin becomes dry, we get extremely fatigued, we get constipated, and we have a decreased ability to handle cold. And so that's one thing that we could potentially address in this woman, is looking at thyroid hormones. Now, for thyroid hormone testing, on a first visit, if a patient is coming in with a suspected thyroid deficiency or dysregulation, we're going to want to make sure we run a whole, we got a motorcycle going by, we want to make sure we run a whole thyroid panel. And so what a full thyroid panel for me looks like is TSH, total and free T3, total and free T4. Then we also want to look at reverse T3, which T4 can become reverse T3, stealing it away from the active T3. And then we also want to look for antibodies, anti-TPO and anti-TG, especially if those have never been run before in a person's life. So that's kind of the comprehensive thyroid picture that we want to look at. Now, in terms of the testosterone side of things, so with menopause, all of the hormones are going to go down. But what some people might not realize is that when you actually look at the absolute values of hormones, even in women, testosterone is more prevalent than estrogen or progesterone, which are the classical female hormones. Now, the normal levels of testosterone in a female are about 1/10 of that in a male at the high end. And so I'm not saying that women have, levels of a man, but what I am saying is that of the 3 hormones that go down, we see a larger decrease in terms of absolute values on the testosterone. And so we see a much bigger drop in testosterone, which can contribute to muscle atrophy, can contribute to bone loss, can contribute to fatigue, vaginal dryness, decreased libido, decreased mental functioning, decreased quality of life, and just feeling of motivation and happiness. All those things go down when testosterone starts to go down. And so that's also something important to look at when evaluating a postmenopausal woman who's having symptoms like this. Now, in terms of what tests to run, typically I'm going to run for testosterone, we're going to look at total testosterone, free testosterone with sex hormone binding globulin. You're going to want to make sure that you run a CBC as well, because you're going to get albumin, a CMP, because you're going to get albumin out of that, which again can be part of the binding of total testosterone, which could decrease the free testosterone. And then I also look at some of the precursors like DHEA and that kind of stuff. And so kind of tying all this back in, even though menopause is a natural part of a woman's life, it doesn't mean that women have to suffer from symptoms of low hormones. And so in those situations, I feel it's appropriate, and with my patients, we look at those hormones and we look into how we can test and how we can treat, whether that's looking at nutritional, lifestyle, supplements, herbs, or even bioidentical hormone replacement. So if you've been suffering from things like this and your physician is not open to looking at testing for you because your levels are going to be low regardless, I encourage you to find a physician who is willing to work with you, because you don't have to be feeling like that all the time. All right, guys, see you later.